Okay, so we're going to look at this teeth model and try and document the materials used in the model and also the condition of the model. So looking closely, trying to look for any clues of what the materials might be. And we can see in here where there are losses, a very white powdery surface. So this white powdery surface makes me think that we have a plaster model, and then the plaster components look to be all the teeth here, and then this base. But then here, I think we've got two wood supports that sit underneath there. So we've got plaster, wooden bases here, and then our media, our paint surface is this cream paint and then black here. And you can see that the plaster has been, well polished and ground into the shape of the teeth and then painted. Like, it's very smooth, it's reflective. You can see it there. So materials, plaster, wood, and then the media is the paint, this cream paint, and also the black paint. And then we've got wire holding those two, upper and lower parts of the teeth together, like so, all the way around, holding them so they're almost, grinding themselves. So now we'll think about the condition of these materials. So first off, I'll just turn him over so you can see a little bit better those wooden support that are here. So we've got loss and abrasion, scratches, a little bit of surface dirt there too. So looking back at the plaster, we've got loss in these areas where we can see the white. So that's loss of that surface coating, that paint sitting on as the top layer, and also the plaster as well. So when we compare it to, a complete tooth, we can see that the tops of those molars have been worn away. And here we've got loss of the plaster. This one looks more like just loss of that paint layer sitting, just that very superficial top layer. Surface dirt, particularly in areas where it can pull and sort of hide. So if I put my finger down here, I can get a little bit of, and you see it's sort of a bit grubby, in these crevices, just like, again, like your teeth, after you've been eating bits where food remnants can catch. Same idea with these teeth. I'm going to turn it over so we can have a look at the other side. You can see more damage. The damages that you see here are probably encouraged by that wire moving, and rubbing across the surface of the tooth. If we move a little bit down here, we can see some pen or some graphite. So let's just do a bit of recap about the damage. Both supports, the wood and the plaster, have losses, scratches, abrasions. And if we're looking at the paint surface, the media on this object, this black paint and the cream, we've got cracks and losses, surface dirt, but it looks pretty stable. We want to look at sites where there's been disruption to the paint layer to see if any of it's cracking or flaking off, because there are points of weakness because there's loss there, and it looks to be pretty stable. So if this object was to be housed safely and not frequently handled, it could stay in this condition. If they'd like to display it, use it in the future, especially for a teaching purpose, these areas of loss would need to be infilled. and they can be mimicked off the surface of full teeth, undamaged teeth. And you can see inside some of these molars there's a bit of white powder, so it is continuing to flake away that plaster. So it would be worth doing some cleaning, get rid of that surface dirt and those residue powders, consolidate, infill the losses and in paint. So we can talk to the collection manager about whether that's an appropriate treatment and put forward a treatment plan for her to approve as a sort of a type of contract. A lot like when you go and get your teeth done at a dentist. You need to understand your current condition, what the dentist's going to do to you, and how much it's going to cost and how long it will take. We'll do that documentation to allow us to communicate the needs to the collection manager.